Hi, this is Amna, optometrist from Global College of Allied Health, Natalam. Today the topic is about primary angle closure glaucoma. Definition: primary angle closure glaucoma is an acute, subacute or chronic glaucoma due to the obstruction of the aqueous outflow slowly caused by the closure of the angle by the peripheral iris. Etiology: age 4th to 5th decade, sex female, personality emotional, nervous people with unstable vasomotor system. Types of the eye is affected: small hypermetropic eye, shallow anterior chamber, narrow anterior chamber angle due to the smaller cornea, bigger size of the lens, and bigger size of the ciliary body. Laterality: initially unilateral, but frequently it becomes bilateral. Stages: it is divided into five stages: prodromal stage, stage of constant instability, acute congestive attack, chronic congestive stage, stage of absolute glaucoma. Symptoms: colored halos around light, blurring of vision, occasional headache. Signs: the eye remains white and without congestion, even though there may be transient sudden in IOP up to 40 to 60 mm of Hg. Stage of constant instability. This second phase is reached when intermittency of predominal attacks is replaced by regularity. The IOP may rise in the late afternoon and evening but reduces spontaneously during sleep as the pupil becomes constricted. Acute congestive attack. An acute congestive attack occurs sooner or later, and it is always associated with a closure of the angle and a severe elevation of IOP. Symptoms: acute, intense, unbearable pain radiating along the distribution of the fifth cranial nerve. Severe headache, often with nausea and vomiting, often mistaken for an acute abdomen. Marked dimness of vision is mainly due to ischemic optic neuropathy and partially due to corneal edema. Redness, lacrimation, and photophobia. Eyeball tenderness is present. Eyelid marked edema with narrowing of the palpebral aperture. Conjunctiva both ciliary and conjunctival congestion with chemosis. Cornea steamy and insensitive. Anterior chamber is shallow. Cells and flare may be present but no keratic precipitate. Iris pattern is lost and discolored. Pupil mild dilated and vertically oval reaction to light. Accommodation are absent. IOP is markedly elevated. Visual acuity may be reduced to perception of light and projection of rays. Fundus it cannot be visualized due to the hazy cornea. Similarly, after installation of glycerin drop, gonioscopy shows marked narrowing of the angle with or without peripheral anterior synechiae. Diagnosis: in an acute and chronic congestive stages, the nature of the condition is usually obvious, but the diagnosis of the angle closure glaucoma is really difficult in the predominant stage and is of immense importance. Management in early stages: meiotic therapy, that is installation of pilocarpine 2% every 5 minutes, is usually effective in pulling the iris from the angle and aborting the attack. The fellow eye should be treated with 2% of pilocarpine 3 times per day. Yttrium aluminum garnet laser, peripheral iridectomy, that is the PA. Thank you.